All right, this meeting's called to order. Oh, that was weak. There we go. Good morning and welcome. This is our second July SEB board meeting of the season, and I believe our last meeting, is that correct, Dave, of the season. Our meetings are going to continue to be hybrid. HCA staff will be on site when possible. Board members and other attendees have the option of attending on site or via Zoom. For our members of the public attending via Zoom, the opening slide has information on how attendees can turn on closed captioning subtitles. Also, public meeting attendees will be able to activate their audio and video during designated public comment periods, and we'll be able to control that here from the room. For board members attending in person, please remember to turn on your microphone so that we can record. Let's do intros. Pamela.
Good morning.
Good morning. Carrie.
Good morning.
Morning. Myra.
Good morning.
Morning. Lara.
Good morning.
Morning. Terry.
Good morning.
Omid.
Good morning.
Morning. Donna.
Good morning.
And Allison.
Good morning.
We also have Katie Hatfield from the Attorney General's office. Morning, Katie. And my name's Lou McDermott, and I'm the agency's COO and chair of the SEB board today. With board members attending both in person and virtually, it's helpful for the board to hold their questions until the presentations are done or when the presenter pauses and asks for questions. Board members attending virtually will be watching for your Zoom hand. And we have several resolutions scheduled for today's meeting. The public is going to be able to provide specific comments related to each resolution before the board votes. And the public will also be able to provide general comments at the end of the meeting during the public comment period. At that time, public participants will need to raise a virtual hand. We will take their names and then we will call on them and activate your audio and video, or give you the ability to turn on your audio and video. And as a reminder, if the public has questions during the staff presentations, the presenter's contact information is included at the end of the presentation, and you're welcome to email the presenters with your questions. Dave's going to give us an overview of today's agenda. Dave.
Good morning, Chair McDermott, members of the board. Today we have the hopeful final actions of the board for this board season. We have 7 resolutions coming back to you for action today, 2 related to hearing aids in the Uniform Medical Plan and 5 related to plan offerings in the medical portfolio for 2026. After that action, we begin our official pivot to open enrollment readiness. I think I've lost count at this point, but it's like 75 business days away. I just know that it's a lot closer than we all realize. And so we'll have some updates about that, as well as our progress on Benefits 24/7. And then we will be rounding out our board meeting with a presentation in response to some of the questions that all of you have asked and your sister board have asked this season about what it looks like for a request for proposal for medical plan offerings, and if there's the possibility of additional medical plan offerings in the portfolio's future. So John Parton will go over kind of the academic conversation of what that takes and what it looks like. Then we'll just have a quick conversation about next board season, and we will be done for the year, and everyone can go on summer break part 2 for the context of all of you. Just a reminder, bathrooms down the hall. If you see elevators, look to your left. If we have an emergency, walk purposefully across the street into the visitor parking lot. Feel like a flight attendant. The exits are on your left and on your right. And with that, back to you, Chair McDermott.
Is there a blow up thing under our? No. Okay. No water
No
landing.
flotation dedevices.
Okay.
And no peanut service either.
No peanut.
Actually, there are sets
Yes, we
if you
do
do.
have, but it's self-serve.
self-service.
Yes. Do we have any additional questions for Dave? All right, let's get rolling. First, we're going to approve the July 9th, 2025 meeting minutes. They're behind tab number 3. Are there any comments from the board? Seeing none, do I have a motion to approve the minutes as written?
Pam Cruz, I move to approve the minutes as written.
Is there a second?
This is Allison, second.
All in favor, say aye.
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 Any opposed? Seeing none, the July 9th, 2025 minutes are approved as written. Thank you. And now Ryan Ramsdell is coming up to UMP team manager in the Herb division, is going to bring back a couple of resolutions for voting today regarding hearing instrument coverage in the UMP plans. After Ryan reviews the resolution, we're going to ask for a motion to adopt. A second, we're going to invite public comment. On the resolution, we'll ask for any additional comments from the board until we are ready to vote. Materials behind tab number 7. Ryan, welcome.
Chair McDermott, members of the board, my name is Ryan Ramsdell. I am the UMP TPA account team manager. I'm going to walk you through hearing aids again. Next slide. So we have 2 resolutions to be have action taken on, and I'll provide a little bit of feedback and follow up from inquiries since the last board meeting. Next slide. So one of the topics to discuss just briefly are circumstances when higher cost medical devices are prescribed due to medical necessity under the hearing aid benefit. Regents does believe that most members will be able to obtain a hearing aid that will meet their medical needs through the established allowable amounts that has been put in place for this arrangement. There are some circumstances where we've had questions about things such as cochlear implants and so forth. Those are a separate benefit through your medical plan, or medical arrangement, so that is separate from this hearing aid allowable amount arrangement. Of note related to cochlear implants, because as come up, there is a HTCC out there that has to do with bilateral cochlear implants. So if you were to investigate that, as something to be considered within that.
And HTCC for the
Health
group.
Technology, I forget the set.
Clinical committee.
Thank you.
And they review new devices and things like that and make determinations on whether or not there's efficacy around using them. And if not, then they get excluded.
And it's unique to UMP. So the second point to that has arisen is that in the event that an individual should seek out hearing aids that beyond the medical necessity component of it might come with more features or things that are of interest but are not medically required. There are mechanisms in place for members to be able to contemplate a informed consent or some other approach to seeing whether or not they can pick up the difference on that hearing aid. We've had circumstances like that before.
So I think just a key piece, somewhere between the allowed amount and cochlear implants, there might be some device that for some reason has a medical necessity determination that a member needs. And they would be able to potentially get that fully covered beyond what is contemplated as the allowed amount via something like an appeal. So just wanted to be clear that there's kind of like this medical necessity valve beyond what is kind of like being thought of as maybe a standard hearing aid that should qualify and be covered for most instances, but there is this medical necessity escape valve, if you will, to make sure that there's coverage if there is something that's needed. And just talking about the gradation of kind of a standard hearing aid all the way up to cochlear implants, which again, Ryan said is a separate benefit. It has separate coverage determinations, but just wanted to highlight that there is this medical necessity valve that exists.
And then lastly, as bullet point 2 says, this is an evolving topic. So you're probably going to hear more about hearing aids in the next series of board sessions.
We talk about hearing aids a lot. I anticipate we're going to continue talking about hearing aids next year. There's just been so many nuances. Like I said, there's been 4 or 5 pieces of legislation since 2017. And so there's a lot of evolution on this particular benefit and how it's covered and what the requirements are. And we learn new things all the time. And I fully expect that we're going to still continue having more to bring back to you next season. So we thought about maybe whether we could tweak this resolution, but I think we're going to be revisiting the topic next year anyway. And this gets us most of the way there.
Any questions? All right. As a reminder, next slide, I will read to you quickly the resolution that had been adopted on June 1st, 2023, and then I'm going to turn it over to the board for action on a rescission as well as a new additional resolution. So as a reminder, adopted on June 1st, 2023, it was resolved that beginning January 1st, 2024, prescribed hearing instruments in all uniform medical plans will be covered up to $3,000 per year with hearing loss at least every 36 months without member cost share. Coverage for members enrolled in UMP Achieve 1, UMP Achieve 2, and UMP Plus are not subject to the member meeting the plan deductible. Coverage for members enrolled in UMP High Deductible are subject to member meeting the plan deductible. And with that, I will turn over the first resolution, which is a rescission.
We're going to vote on Resolution SEB 2025, rescinding Resolution SEB 2023-05, UMP hearing instruments. So resolved, effective January 1st, 2026, Resolution SEB 2023-05, as adopted on June 1st, 2023, is rescinded. Is there a motion to adopt?
Pam Cruz, I move the resolution as presented.
Is there a second?
This is Allison. I second.
Are there any comments from the public? Seeing none. Any comments from the board? Seeing none, it's roll call vote, starting with Pamela.
Aye.
Carrie,
Aye.
Myra,
Aye.
Laura,
Aye.
Terry,
Aye.
Omid,
Aye.
Donna,
Aye.
Allison,
Aye.
and Lou, aye. Resolutions 2025-03 passes. All right, and it's replacement. Resolution SEB 2025-04 UMP hearing instruments resolved that beginning January 1st, 2026, prescribed hearing instruments in all uniform medical plans will be covered at 100% of the allowed amount every 36 months. Coverage for members enrolled in UMP Achieve 1 and UMP Achieve 2 is not subject to the member meeting the plan deductible. Coverage for members enrolled in UMP High Deductible is subject to the member meeting the plan deductible. Is there a motion to adopt?
Myra Johnson, motion to adopt.
Is there a second?
Pam Cruz, second.
Any comments from the public? Seeing none, any comments from the board?
Lou, I just want to confirm
Yes.
with the coverage at 100%, that's to allow, we don't have to come back every year and say, oh, this dollar amount, this dollar amount. It's just covered, correct?
Is that correct?
That is the intent, is
The
like,
intent.
we're trying not to have a dollar amount in there that way, if
Whatever happens, it's covered.
correct.
But to Dave's point, lots of legislation has been
Yeah.
flying, so we, based on changes they make, we may be back talking about it again. But yes, I think that's the intent. Other comments or questions from the board? Roll call vote, starting with Pamela.
Aye.
Carrie. Myra.
Aye.
Lara.
Aye.
Terry.
Aye.
Omid.
Aye.
Donna.
Aye.
Allison.
Aye.
And Lou, aye. Resolution 2025-04 passes. Thank you, board. Thank you, Ryan.
I do have one more comment for the board, not related to UMP, but just as a reminder, we didn't do a specific presentation about the fully insured. I just wanted to tie this together a little bit. Ryan made a mention of it when he did his presentation a month ago, but there are slight adjustments that Kaiser and Premier are making that are in the same spirit. It's a little bit different because of their particular settings, but it's embodied within the rates that you're going to be asked to vote on under Tanya's resolutions. Just remember that Kaiser has an in-network a network that is, there is no out-of-network coverage for hearing aids. They have both audiology centers that have testing as well as the hearing instruments themselves that are available. And then they also have contracted providers outside of those centers, if you will. So just wanted to write, like, nothing is really changing in that front. They have some behind the things that have to change, but that's why we didn't really bring a specific presentation to you about it. We actually did do one in SEBB, and it actually raised more questions because it really isn't fundamentally changing in that environment. So I didn't bring a presentation to you about it, but just drawing attention that this isn't a legislation that uniquely impacts UMP. It's just this is how it manifests for UMP, and we brought you specific resolutions on UMP because of the benefit design direct authority that you have over that portfolio. So just wanted to remind everyone that this hearing instrument conversation wasn't only about UMP. The rest of the modifications that Kaiser and Premier are doing are kind of behind the scenes and aren't really changing the member experience in a significant way.
Any questions from the board on that? All right, Tanya Duell. Thank you, Ryan. Tanya Duell, Herb Finance Manager in the Financial Services and Healthcare Purchasing Administration, is going to bring back the SEB Program Plan Year 2026 premium resolutions for voting today. And again, after each resolution, motion to adopt, second, public comment on the resolution, board discussion until we're ready to vote. Tanya's materials are behind tab number 5. Tanya, welcome.
Thanks, Chair McDermott, members of the board. All right, well, I am back today to ask the board to authorize the plan year 2026 premiums. Last week, we had a really lengthy, really great conversation around the proposed premiums for 2026. Most of those slides are included in your appendix if we need to reference anything. but we have just two brief slides before we'll talk through the resolutions. The first one is just a reminder of the employee premiums comparing the 2026 versus 2025 rates. So again, these are sorted by carrier, comparing what the members are paying today for any given plan versus the proposed 2026 premiums. These are all the single subscriber rates. And then the year-over-year change in terms of dollars and percentages. We do have one additional slide that was new, and it was asked last week that we bring back, just noting the deductible and the maximum out of pocket. We call it a MOOP, but that's the maximum out of pocket. As well as we put next to it the proposed 2026 premiums for you. So you can see what that single subscriber deductible looks like, the MOOP, and then the 2026 premium. And then we carried over the enrollment, so you can see which percentage of enrollment is in any of those given carriers or plans. So like Dave mentioned just a second ago, in reference to hearing aids, I do want to point out that all of the benefit design changes that we've talked about throughout this board season, I think a few of them have been kind of scattered throughout, will be included in the rates that you see here today. So when we ask you to take action and authorize the premiums for any given carrier, it's authorizing the premiums for the plan shown on the screen. So you'll note that UMP Plus does not have a premium. So when the board authorizes the UMP resolution, there will be no UMP Plus plan, as well as those underlying plan design changes we've talked about so far. There will be one proposed resolution per carrier. And I will pause for any questions because really I turn it back over to you, Lou, to take over all of the resolutions.
Any questions for Tanya? Oh, there's one.
I have a comment and a question. So I really appreciate the new slide with the maximum out of pocket. And it's curious to me whether or not in the marketing of program options, if there is a concise way for folks to be able to see all of those pieces moved together or placed together.
So we have a document that's called Benefits at a Glance, but it's like 8 pages at this point because it's lots of charts and keeping track of the plans. But the first page of it does have premium, deductible, MOOP. So it is kind of presented in this similar fashion. And so that first page is really the high level. And then we hope as people are curious about a specific benefit line that they can turn the page into the other 6 or 7 and go, oh, I care about chiropractic. Oh, I care about vision. I care about drug coverage. But the top part of that document or the first page of it is a similar layout here to having deductible, out-of-pocket maximum, and premium together.
Excellent. And then my second question has to do with, there's a pretty significant changing healthcare landscape with some of the federal changes. And I think an old timer here. So we haven't been through a procurement process since I've been on the SEB board. And I'm just wondering, is there strategy around these federal changes when there might be procurement? As it just feels like year over year, there's lots of cost growth in a lot of ways. So it doesn't affect my vote, but more of a curiosity about what is ahead in that way. You are totally a dinosaur. A very nice dinosaur, but that's right.
To answer your question, Allison, I think the theory behind state procurement law is that there should be periodic market checks because there are a lot of things that change, and to make sure that the taxpayer dollars are being spent on in a wise and efficient and in a steward fashion. So, I think the theory is like things do change on some sort of periodic basis. The last time a procurement was You're correct. The last time a procurement was done for this portfolio was summer of 2018 for the launch of the program. And in PEB, it's actually been even longer than that. I'm not sure that I can actually nail down a specific date. It is something that is there's a natural point after a certain number of years where it's like, how much has the market changed? What are the dynamics? And those are some of the things that kind of go into place as to when these things might happen. And certainly, no one can predict what one or two, no, I'm not sure we can predict what next week brings, let alone 1, 2, or 5 years down the road. But I think, if there is a procurement in the future, and again, John will talk about kind of the academic conversation on that, it does cover the preparatory work for that, and the timing that it takes does cover a very, it is an extensive amount of time. And, there is a ability to kind of navigate some of the changing landscape in real time, but then at some point it's like, well, then that will have to be part of another procurement, or there's these tweaks that happen along the way. But you're right, like as you start to like make adjustments over the years, at some point you have to reboot. And state procurement law kind of anticipates that and suggests that. So is that somewhat
That's
helpful?
excellent. And does the legislature direct you to do this? Do you ask the legislature if you can do this
We have the authority in
in the
law.
procurement? Okay.
And sometimes they do say, you're going to do this. I believe that's how the high deductible plan came about. I believe there was a requirement by the legislature. So and obviously the ledge can kind of do whatever they want
Right.
every year anyway. So yeah.
It's both and. There's kind of
Okay.
the independent statutory authority, but the legislature could step in and prompt something to occur, or prevent something from occurring.
And Dave, I think the last PEB procurement was UMP plus.
Yes, that wasn't a mark. That wasn't a port. Yeah, that the last procurement in PEB was for UMP plus for
Yep.
a plan.
Yep.
Which would have been 2014.
Yep.
But the rest of the portfolio, it's been longer.
Long time
Much
ago.
longer. All right. Additional discussion?
Who had not gray hair then?
I had gray hair. My dad had gray hair when he was 22, and mine came when I was like 30. So I was like feeling lucky.
Thank you.
Other questions or comments from the board? All right.
Right. Then I'm going to turn it over to you to walk through the proposed resolutions.
This is the interesting part of the year, when I read these, we just go through them, we vote, but I always just think about how much work, time and effort and the number of meetings and discussions and how things start over here and wind up over here, the evolution of it. So just wanted to acknowledge all the work and effort that goes into this as we sort of whip through them and vote. But yeah, tons of effort. All right. We're going to start off Resolution SEB 2025-05, Kaiser Foundation Health Plan of Northwest Medical Premiums. Resolved that the SEB Board authorizes the Kaiser Foundation Health Plan of Northwest 2026 employee premiums. Is there a motion to adopt?
This is Allison, so moved.
Is there a second?
This is Donna. I second it.
Okay. Any comments from the public? And just a reminder for the public, you got to put up your Zoom hand so we can see you. Seeing none, are there any additional comments from the board? All right, roll call vote, starting with Pamela.
No.
Carrie.
Yes, with some reluctance. We've been talking about the changing landscape, healthcare and whatnot. And one of the things that's been very important in the plan design is to have, as our chart shows, a certain consistent set of out-of-pocket expenses for deductibles and co-insurance and those kinds of things. And so that when people are trying to evaluate how much they may spend, the premium reflects that particular plan design. And we're starting to see proposals where lots of other things are getting shifted behind so that the premium looks less impactful than it actually is. And that becomes a problem for people to try to plan where their expenses go. And the image that I thought of is you go to the grocery store to buy your favorite cereal and the box costs more. And then and so you say, okay, it cost a little bit more. And then you start reading the details and you discover, well, there's 3 ounces less product in there. And you read some more and you see they've changed some of the ingredients. And I don't like some of those ingredients. And then finally you find out that that box of cereal won't be available in your favorite store. And so that makes it really hard, particularly if you're comparing 2 kinds of cereal. It makes it very hard for you to, at least for me, maybe everyone else can do this, but for me to figure out what all the impact is and what is going to be in my best interest. So that's what it feels like we're starting to get to. If we're thinking about going out for another RFP, I think one of the hardest things is going to be to decide what the basic plan design options are going to be and what we are going to expect from plans in terms of being able to deliver a good product, being able to ensure that there'll be good networks that are available to people where they need them, and that they can explain what benefits people are actually getting in that plan. So I will vote yes, but it is with some reluctance.
And I just want to remind the board, I know we have a portion where we ask if there's any comments from the board, but this board hasn't been around forever. And in PEB, there are times when people vote and they want to talk about it a little bit and they want to sort of express themselves. So totally cool. We do that quite a bit in PEB, as a matter of fact, as people vote. So don't feel like you're just restricted to yes and no. And Carrie, that was a good reminder to me to remind everyone this. Yeah, if you want to talk about it a little bit, feel free. It's your time. Myra.
Yes, also reluctantly. To me, communication, the member, and transparency is vital. It's very critical, and I really like that cereal analogy. It fits. So yeah, it's with reluctance, but I.
Thank you, Myra. Lara.
Yes.
Terry.
No. And I'd like to add that I believe Kaiser has not been a good partner with us since the beginning. Like Allison, I've been here since the beginning, and I just have trepidation with this. So no.
Omid.
I echo what I've heard today from the board, and with reluctance, vote yes.
Donna.
Man, this is a tough one. The increases that are happening just eat into our income, especially as a classified staff. It's far outpacing inflation, which is our paychecks are barely keeping up with that. So, but I'm gonna vote yes, but again, reluctantly. I think they could do better.
Allison.
I share my colleagues' reluctance in voting yes. I think part of what factors into my decision to vote yes are the folks who are in the middle of important treatment that, if this plan wasn't available, might affect their ability for care. And the changing healthcare landscape is only going to make it more complicated for folks to understand what they're entitled to and what they can expect from both their providers and payers. So I think we have a really important responsibility to both steward the program design of this and the dollars that are being allocated to it. So yes.
And Lou, yes, resolution 2025-05 passes, and I want to assure the board that you are being heard. We do hear what you're saying. Next up, resolution SEB 2025-06 Kaiser Foundation Health Plan of Washington Medical Premiums. Resolved that the SEB board authorizes the Kaiser Foundation Health Plan of Washington 2026 employee premiums. Is there a motion to adopt? Is there a second?
This is Allison, or seconded.
Is there any comments from the public? Nope, seeing none. Any additional comments from the board?
Oh, sure, why not?
How about it?
So I hear what everyone is saying today, and I know in Zoom land or wherever that there are many people listening to our comments. But the reason I am definitely voting no is I want it on the record that there were no votes. And because when you look at the minutes, you're not going to see reluctantly yes, begrudgingly yes. You're going to see 5 yeses, 2 nos, whatever it's going to be. So that's why I definitely want the no on the record.
Just out of curiosity, I'm assuming the meeting minutes will reflect the additional conversations.
So we do summary notes, and I think Pam's right that at a high level, it will say who voted which way.
Yeah.
And then if people want more detail, we do have the audio file that's linked in the minutes for people to go see and, well, go hear the entire conversation, but we don't do a detailed summary of the conversation anymore.
Okay.
In the early days, we used to do transcribed minutes. And then you were
Oh, my.
approving minutes months after the meeting occurred, and we transitioned to the summary minutes along with the audio file. So there is a way for it to be heard, but Pam's right that at a high level, at this point, what we have always done is listed the vote as whatever, like the last resolution would be listed as 7 votes yes, parentheses, every person's last name who voted yes, 2 votes no, every person's last name who voted no.
Got it.
Is it possible in the high level to summarize some of the comments that were made, that if there was a pattern of concerns or issues or something that came up, show the vote and who voted, but then say, here are 3 things that were brought to our attention as part of the vote. Is that possible without?
I think if board members want that, I think that is something we could do, because when it comes to public comment, that's actually how we handle public comment in the minutes, is we say who public commented and we highlight themes. We haven't had historically a lot of discussion on votes, and so we can make that adjustment, because I don't think we've had a significant level or possibly any no votes since we transitioned to summary minutes. So we can absolutely bring that way in the future as like a couple of sentence summary of the spirit of the conversation.
Excellent. Additional comments from the board? All right. Roll call vote, starting with Pamela.
No.
Carrie,
Yes.
Myra,
Yes.
Lara,
Yes.
Terry,
No.
Omid,
Yes.
Donna,
Yes, with the same trepidation.
Allison,
Yes.
and Lou, yes. Resolution 2025-06 passes. Next up, Resolution 2025-07, Kaiser Foundation Health Plan of Washington Options, Medical Premiums. Resolved that the SEB Board authorizes the Kaiser Foundation Health Plan of Washington Options, Inc., 2026 employee premiums. Is there a motion to adopt?
This is Allison, so moved.
Is there a second?
This is Donna. I second it.
Any comments from the public? Seeing none, any additional comments from the board? This will be a roll call vote, starting with Pamela.
No.
Carrie,
Yes.
Myra.
Aye.
I'm sorry, Myra, one more time.
Yes.
Okay. Lara,
Yes.
Terry,
No.
Omid,
Yes.
Donna,
Yes.
Allison,
Yes.
and Lou, yes. Resolution 2025-07 passes. Next up, Resolution SEB 2025-08, Primera Medical Premiums. Resolved that the SEB Board authorizes the Primera 2026 employee premiums. Is there a motion to adopt?
Pam Cruz, I move resolution SEB 2025-08.
Is there a second?
This is Terry. I'll second.
Any comments from the public? Seeing none, any comments from the board?
Chair McDermott,
Yes, sir.
rather than wait before my vote, I was going to make a comment that I am, as we've reflected in our discussions regarding the Kaiser plans, equally concerned about the Primera plans on 2 accounts. One regarding consolidation as Primera starts to offer its own primary care providers and asking members to preference their network of providers, which they own. This consolidation and a further consolidation of healthcare by insurers and carriers is starting to remove choice for our members and competition increasing final cost and likely worse health outcomes for our members. So that is a concern I have, particularly as it relates to Premera. But one area that is going to lead to my eventual no vote today is regarding Premera's decision and its prescription benefits. We learned last week that members in Premera who were receiving mail order 90-day prescriptions can be on the hook for up to 4 months of additional um, of copays for their prescriptions. That could be a cost increase of anywhere from $40 to hundreds of dollars per year that are unplanned and not reflected in the premiums and out-of-pocket costs that a member will likely just roll into. I am concerned that these are going to be surprise expenses for individuals. And if there is leadership from Premera listening to this call, I hope that they have a plan to message this early so that as members roll into open enrollment, they can make the informed decisions they need to in order to plan for those cost increases. This is reflective of state legislature legislation to increase competition, to reduce the power of pharmacy benefits managers and allow members to have more choice in where they receive their prescription. All in all, a very good bill, but Premera decided to pass the cost on to our members rather than find other ways to comply with that legislation. There was more than one way to comply with it, and Premera's decision, unfortunately, it seems like, was to pass the cost on to our members. So I wanted to make that comment before we vote today and state that it is reflected in why I will vote no on Premera's resolution.
Appreciate your comments. Others? All right, this will be a roll call vote, starting with Pamela.
Aye.
Carrie.
A reluctant yes for the reasons that Omid talked about. To me, this is another example of where you're changing the ingredients behind the scenes. And it's not always apparent how that might affect somebody. So I concur with his comments about concern about what's happening here.
Thank you. Myra,
Yes.
Lara,
Yes.
Terry,
No.
Omid,
No.
Donna,
Again, with the premiums far outpacing inflation and the cost rising and behind the scenes, I'm going to vote yes, but reluctantly.
Allison,
I appreciate Omid's comments, and so I'm going to reluctantly vote yes as well.
and Lou, yes. Resolution 2025-08 passes. Next up, Resolution SEB 2025-09, Uniform Medical Plan, Medical Premiums. Resolved that the SEB Board authorizes the Uniform Medical Plan 2026 employee premiums. Is there a motion to adopt?
Pam Cruz, I move resolution SEB 2025-09.
Is there a second?
Myra Johnson, I second.
Any comments from the public? Seeing none, any comments from the board? Seeing none, this is a roll call vote, starting with Pamela.
Aye.
Carrie,
Aye.
Myra,
Aye.
Lara,
Yes.
Terry,
No.
Omid,
Yes.
Donna,
Yes.
Allison,
Yes.
and Lou, yes. Resolution 2025-09 passes. Thank you so much. Appreciate it. We have, thank you, Tanya. Anything else from Tanya? Nope.
Just Chairman Duray, I'd like to remind people, especially if you're just tuning in for the first time in virtual land, that seems like a very fast process for a lot of work. The board, before this morning, there were no plans offered for 2026 until the board takes an affirmative majority yes vote. There aren't plans for the next year. And that seems like a very fast process right there. But there are months of work from staff, as well as many executive sessions and some public presentations and recent meetings that all culminate in the actions that the board just took. So I just want to thank thank Tanya, the finance team, everybody in our portfolio management shop that does negotiations. And yes, even the carriers, because I know that these are frustrating and challenging decisions on everyone's part. But they are working with us as we negotiate on different parts to be able to bring you premiums for plans for the portfolio. So just want to thank everybody for the process that culminates in these votes, even though it seems really quick when it's like 10, 15 minutes of rapid fire voting. And I see Pam, you turned on your microphone.
No, I just wanted to echo because Tanya and your team, oh my gosh, you do so much work for us and make it very smooth. Your shoes look great, by the way. Squirrel. But you've answered all of our questions and you're very calm, even though we're a little crazy with some of our questions, but thank you.
Thank you. Not sure I've ever been called calm, but I'll take it.
She's a Spitfire in the back room.
Love it.
All right, Tanya, thank you. Next up, we're going to have Alyssa Richards, Benefit Account Section Manager in the Herb Division, and Brett Mello, the CIO for the Healthcare Authority. We're going to go over the SEB's programs work to prepare for this year's open enrollment in the fall. The presentation will also include the latest information regarding benefits 24/7, materials behind tab number 6. Alyssa, Brett, welcome.
Thank you. Good morning, Chair McDermott, members of the board. For the record, my name is Alyssa Richards. I'm the Benefits Account Section Manager. I'm here today to talk about how we are preparing for open enrollment in 70-ish business days. So, next slide, please. So we work on open enrollment activities all year long. We really start in March, planning meetings with other areas of the agency to talk about action items, work items that need to be completed, and then identifying anything that didn't go well from the previous open enrollment and trying to improve that for the next open enrollment. In April, we start planning the benefits fairs. So that is a lot of work where we're working with potential vendors or sites to host the fairs, working with the carriers to start getting things scheduled, planning for the staff that will be attending. And then in May and June, we're really working on the open enrollment communications plan. So identifying how we're going to communicate, what we're going to utilize, what strategies and such. And then in July, of course, we have the board votes on the premiums. And so that really kicks off us being able to finalize those communication materials for open enrollment. And then in August, the finance and communications team, they finalize those rate sheets. And then we really start running towards that open enrollment start date. So next slide, please. So just as a reminder, the outreach and training team, they support over 700 SEB organizations and PEB agencies. The team supports benefit administrators. They do training to prior to open enrollment. They'll provide a training for benefit administrators to talk about plan changes, any service area changes, premiums, what's covered. And then the benefit administrators, of course, are supporting those employees at those organizations. Next slide, please. Okay. The customer service unit is the first line of contact for our retirees and continuation coverage members. They answer a toll-free line and respond to the electronic HCA support inquiries. They also provide in-person lobby services for walk-in members. And then they review retiree and continuation coverage eligibility as they process enrollment forms. During open enrollment, any changes requested by retirees or continuation coverage members are submitted, and customer service staff review and enter those changes for a January 1, 2026 effective date. We have 27 total Mass 3 positions within the customer service team. Right now, we have 25 of those filled, and we are working to get those last 2 positions filled now, which is wonderful. And we'll have 18 staff fully trained by open enrollment. So next slide, please. Every year, the Outreach and Training Unit conducts webinars for benefit administrators to help prepare them for open enrollment. These webinars will also be recorded and later posted on the benefit administrator website, so they can be accessed if anyone wasn't able to attend. Once the dates of the webinars are finalized, they will be shared and advertised with the benefit administrators. The Outreach and Training Unit will provide forwardable email messages. So this is something that we do every year so that they can then in turn send those out to their employees with important information about any plan changes, premium information, et cetera. And then benefit administrators also communicate with Outreach and Training via a toll-free line and or the HCA support portal. Next slide. And benefits fair. So we received a lot of member feedback, which we used to start planning fairs for this year. Locations for the fairs were selected based on member enrollment. I've included the dates, times, and locations on the next slide, and I'll go over those shortly. But based on the feedback we received, we're working with our communications team to have printed materials available at the very first fair, and then also on our website. For the fairs this year, we have fairs scheduled for members to attend at any time, so they can come anytime between 10 and 4:30. And where previously we had designated for retirees and employees, but it's open for all. And then we'll also again offer the virtual benefits fairs, which is available 24 hours a day. And that members can learn about their benefits from their home day or night. They can access it via a computer, tablet, or smartphone. And some carriers provide direct interactive webinars, pre-recorded webinars, and teleconferences to share plan-specific information. So next slide, please. Okay, so as I mentioned on this slide, you'll see the dates, times, and cities for the 14 benefits fairs hosted by HCA. We received some feedback last year. One thing I wanted to note, we did receive some feedback about fairs being on Halloween, October 31st. And so you'll see the dates here. We took that feedback and we definitely did not schedule it on October 31st this year. So I really appreciate hearing from folks about that. So next slide, please. So in addition to the 14 fairs that we host, there are also 4 fairs that we attend that are put on by the University of Washington. You can see the dates and times here. These will be October 20th through the 23rd.
And Alyssa, my understanding is, although UW hosts these and we attend them, they're the largest employer between PEB and SEB. They have over 30,000 employees that are part of the population. It's one of the reasons that we do support their benefit fairs that they host. That it is, UW is okay with us generally kind of doing light advertising of them. And if other individuals who aren't University of Washington employees find it convenient for them to come, that they are okay to attend the fairs as well.
Absolutely. Yep.
So,
thank you. Next slide, please. So this year we do have similar communication strategy as we had in last year. We will have social media posts, the forwardable email messages that are shared with employers, the Retiree Association presentations, the retiree customized letter that will be sent out. There'll be an alert in Benefits 24/7. We'll also include a website alert on the front of HCA's website so members can easily go to the open enrollment web pages to view those important changes. We'll be using the October newsletter to call out information for members to be aware of when considering plans for 2026. And the front page will describe the steps to take to make enrollment changes and include prominent alerts. And then also wanted to call out a couple communications regarding the UMP Plus plan. We'll be sending a postcard, I believe, at the end of August. And then also a letter to UMP Plus subscribers at the end of September, just to make sure that they're aware that that plan will no longer be available. If they do nothing, they will be defaulted into UMP Achieve 2 for SEB. Otherwise, they'll have to make a plan selection during open enrollment.
The other part that I want the board to be aware is, I believe later this month on benefits 24/7 for new employees that are joining the SEB program. And we know that there's like a 10 to 15% new hire in the K-12 system statewide, that there's an alert that'll be there indicating that yes, people can enroll in UMP Plus for the remainder of this plan year, but that the plan is going away and that it won't be available in the future. So we do have some of that information that'll be there for the new enrollees before the next school year starts. I think that goes live in a week or two, but just another piece of context to help people understand what is happening with that plan, but yet they can enroll in it for the rest of this calendar year. I also need to correct something that I said earlier to your question, Allison. I was just reminded that we used to have on the benefits at a glance premium right next to MOOP and deductible. Now it's the benefits at a glance has I said it's in the 6 to 8 page range. As we got to an even number of pages, we had to find some space. And so it's actually a separate premium sheet that's right before the benefits at a glance. So it is two documents that need to be side by side. It's not literal columns on the same page. So I did want to correct myself on that.
Great. Next slide, please. Last year was our first year using benefits 24/7 for open enrollment. And again, we received a lot of feedback from employees and benefit administrators. So we did conduct 4 focus groups with benefit administrators for both SEB and PEB. We just completed those focus groups last week. And so we are working now to compile the feedback from those sessions and then work with the benefits 24/7 team to implement some of the feedback and changes. We really focused on the dependent verification screen. As some of you may recall, you couldn't get past that screen without selecting upload verification, even if you didn't have to do that. So we heard a lot of feedback on that. And then also the spousal attestation process was a little tricky, and we had some issues with that. So we're working with the benefits 24/7 team to review the feedback and make sure that we get things implemented prior to open enrollment so that we have a better user experience this year. So I'll pass it over now to Brett so he can talk about how we are getting the system ready.
Could I make just a quick comment before you go on? I'm looking at the schedule for the benefits fair, and it's great for retirees. I'm thinking if educators are in the classroom during this time, they can't get anywhere before 4:30. So and I know you guys work all day long, it's a full day for you also. But if there was any way to have them some alternating hours later into the evening, just to keep in mind that we still have teachers in the classroom that couldn't even leave campus at this time.
Yeah, Pam, just to give some insights about the timing, because we've adjusted the timing every year for the last couple of years. When we looked at the kind of general participation data, it really trickles off after 4:30. We used to host until 5:30 and 6:30. The first year we were like all out. It was like 12-hour benefits fairs all day, all the time, everywhere because of the launch of the program. But as we started seeing the amount of volume, even though it is marketed for both retiree populations and employee populations on PEB and SEB, the vast majority of people who are attending are the retirees. And we were seeing very little after a 4:30 drop off. So we have moved it to 4:30 this year. Another factor that went into this year's benefits fairs piece is if you were to actually compare year over year, you would notice a lot of subtle different changes. We used to have 4 benefits fairs a week instead of 3 a week. A lot of that is us trying to balance travel costs for staff and some of the overtime rules. And so some slight adjustments balancing the times along with what we were seeing as participation led here. So we'll see what the feedback is I'll be very curious because this is the earliest that we're ending benefits fairs. I think in the kind of historical SEB benefits fair practice, I'll be very curious to see what type of feedback we get, or if we see an uptick in reliance on the virtual benefits fair. But we did make that decision trying to balance some of the budgetary pieces because there's not that much flexibility in the admin budgets of these programs for the budget reductions that are necessary under the operating budget with what we were seeing as participation. And we really saw very minimal participation after 4:30 in the last couple of years. So we'll see. I'll be very curious to see what feedback we get this year about the end time.
Sure. Appreciate your comment though. Thank you.
Well, good morning, Chair McDermott and members of the board. Again, my name is Brett Mello. I'm the Chief Information Officer at HCA. So my first bullet here is really a repeat of what the previous slide. It's the work that we're doing in designing the OE wizard to address things like spousal attestation and dependent verification. And again, this will all be done by OE for plan year 2026. As far as a UMP plus wind down, work has begun on doing that and currently on schedule for completing that work by open enrollment. As far as the annual updates, a few weeks before the OE ERB team provides the benefits 24/7 and pay one teams with an updated rate sheet for the plans that will be available along with any changes to the plan, which is then implemented in the systems. The screen text in benefits 24/7 is reviewed by the ERB team and the communications team for clarity and accuracy. Generally, this is to address any legislative, board, or program changes that have occurred, though sometimes this includes adjustments to make the system more accessible based on user feedback. All updates are provided to the benefits 24/7 team for the implementation in the system. As far as bug resolutions prior to open enrollment, we have multiple efforts to resolve data quality and processing issues that could impact OE, and those are ongoing and will continue to be a primary focus to make sure that things go smoothly for open enrollment. And finally, user acceptance testing. We are in the process of planning our open enrollment acceptance testing with the business. And that is a part of our preparation to make sure that the last kind of pieces of the puzzle fall into place before we roll into open enrollment. Any questions for me?
Thanks, Brett. There are some ways that members can prepare for open enrollment when they're considering changing plans. The best way to prepare is to make sure that you can log into your Benefits 24/7 account prior to open enrollment. Consider signing up for email communications. Write a list of important questions they may have for plans about benefits, prescription costs, deductibles, etc. They should make a list of any of their prescriptions so that they understand how they would be able to transfer any of those if they do decide to switch plans. And then they can prepare mostly by reading the material. So we'll be sending those newsletters. We'll have our open enrollment website, virtual benefits fairs, a lot of materials to prepare them for what might be changing for plan year 2026. So next slide, please. And then once they've reviewed all of the changes for the year, for the plan year 26, they should, if they decide to change plans or waive coverage if applicable, add or drop any dependents during open enrollment, attest to any applicable surcharges, elect their FSA or limited purpose FSA, dependent care, DCAP, complete the Smart Health Incentive, review life and long-term disability coverage, and designate any beneficiaries. And there will be a lot of helpful information and tools on the open enrollment web pages that will help members make the right changes and decisions for their specific circumstances. So
just a couple more things. Seeing decap on that last benefit reminded me of something else that I wanted to share with the board. So there's probably heard there's a bill that passed Congress this month, and it was rather long and has a lot of things in it. And I think the collective analytic community is finding more things every day. One thing that was in that bill that actually I was really surprised not to see much news about it, and it's something that I personally have tried to advocate and help people understand for at least the last decade, is the DCAP benefit. There's actually an increase in the allowed deduction and election amount for the Dependent Care Assistance Program. So for years, for 40 years actually, it has been capped at $5,000. That benefit was originally enacted as part of COBRA legislation, the original COBRA legislation back in the mid 80s. And the bill that passed Congress earlier this month included a permanent increase of that to $7,500 effective next plan year. Not bringing anything to the board about this in particular because the benefit design of the DCAP and FSA benefit is with the agency instead of the board, but wanted to share with you that we discovered that and we're working on implementing that. And we'll see if we discover other things that might need implementing. And so we'll do our best to navigate that in the off season. We might bring things back next year that we find that are opportunities for the benefit package that you need to chime in on. But I did want to share that there is that improvement in the DCAP benefit. And again, I'm very surprised that didn't really see much about that in the news at all. And even after I heard that it happened, I went and searched and there was very little that you could find in news about that particular change. I think that takes us from 2 to 3 months of daycare expenses to maybe 4 or 5 if you're lucky. Not having children, it's a little hard for me to get those exact estimates. I'm looking at some of the moms in the room. But it is at least a slight improvement for the first time in 40 years. It's fixed in statute. It did not have an adjustment, a permanent adjustment to have it change based on inflationary. So maybe it'll be another 40 years till it changes. But it is the first time that there's been a change in DCAP, other than there was some one-time relief during the pandemic that allowed for like $10,000 to be deducted in plan year 2021, I think. But this is the first permanent adjustment there. But that was my long-winded way of saying we'll see what else we find in the bill to share with you about. That work still is ongoing, but that is one piece that we found that we were able to begin immediately implementing as well. And the other thing I saw is at the end of that checklist is designate beneficiaries, and that is such an important thing, and it's something that I'm passionate about because it's important for people to have their benefits, whatever they are, whether it's both in and out of the PEB and SEB programs, whether it's their HSA accounts and whoever receives those, or beneficiaries for life insurance. And I saw a really creative ad from DRS recently that says, if you made your own acid wash jeans, it's time to look at your beneficiaries. And so I just wanted to put that one out there as a creative marketing from DRS and something just like for people who are listening, like if it's been a while, it's been a while. So just a plug there to always check on beneficiaries.
Any additional questions for Brett or Alyssa? All right. Thanks, folks. Appreciate it. All right. Why don't we take a 10-minute break? It is 10:03. Let's call it 10:15. We'll see you in a few.
Test, test. I'm not hearing him. Let me see if I have to put these back up.
Can you hear me? Donna, can you hear me?
We can hear you
Yes.
now. We can hear
Now
you
I can, yes. I
Okay.
had to, yeah.
Let's see. Remember we had that issue with my mic?
Yeah, let's
So
test John again.
Turn off
Can you-
the mic.
Can you hear me now?
I can hear you now.
Okay.
Starting to pulse this.
You may regret bringing that up, but yeah, I'll try to keep it interesting. So again, my name is John Parton. I'm the Benefit Strategy and Design Section Manager here at HCA for the Employees and Retirees Benefits. Want to go over somewhat of a high-level summary of what our request for proposal RFP process looks like. And as was being pointed out during the break, there are multiple variables in this process, right, where things can happen, and things often do in any negotiation process, negotiating a new contract. But as Lou said, I'm focused in this particular presentation on where we would request a new offering, a new plan, a new contractual relationship with a entity that we hadn't had a contractual relationship with previously, and just kind of give you how things are expected to go. There are all kinds of branches in the road when you get into a contract negotiation, but that's what we'll be going over. So if we advance to the next slide, please. So we'll talk about the components. There are 4 major buckets of work, and you'll see those in a moment. And then the typical timelines, what we would normally expect in each of these. And I'll give you some of the high level, what kinds of things fall into each of those 4 major buckets and are occurring throughout the cycle. If we go ahead and advance, please. So as I said, it's a new contractual relationship or benefit design. Want to call out that this is a very structured, for the state, it's a very structured formal process. And the key word in there is that it's regulated. This is not something that we at HCA try to think up what's the best way to go about implementing or finding new contractual relationships. It's highly regulated, and much of it is structured, and it's not specific to HCA. All of that is geared towards ensuring that it's a fair and accurate assessment, and that it's equal and fair playing, kind of a fair field of play as we assess these opportunities in the market. And there are related processes that I'm not going to touch on in great detail today, but just want you to be aware that they're out there. What often leads up to this type of a request for proposal is a decision package, right, to fund an RFP, because they're not inexpensive to do. And we were kind of touching on this earlier in some of the questions that were coming up. And there are also things that might come before an RFP, or request for information, or RFI, where we're trying to assess what's out there in the market. What kinds of things do we think would be important in the actual contract relationship, so that we'd include that info.
Hey, John, I
Yeah.
think sometimes people don't understand, like, why would it cost money? If you could go over that a little bit, the actual costs and things like that.
So there definitely is an impact from reviewing the financial analytics that go with this, and that can be internal to the agency. It could also be something that we go to one of our actuarial partners outside the agency to review. There is a significant amount of legal review and negotiating with the entities that we might want to do an arrangement with. And that takes time, and it also takes billable hours, right, for the legal staff and the contracting teams that have to negotiate those arrangements. The amount of time that's required from internal subject matter experts to review a proposal, and we'll talk about this in a little bit more detail when we go through the buckets of the components, is not insignificant. So there are a variety of areas where there are potential costs and administrative costs, right? They may not be direct costs of executing a contract, but there are administrative expenses that go into the issuing a RFP, reviewing it, and then actually negotiating the contracts for implementation. And the implementation work is not, it's not like we just push a button and all of a sudden it all happens. We'll talk about that a little bit towards the end of this presentation. But all of those things have significant resources that are required to make them happen. So
the only one I'll add that you didn't expressly say, John, was sometimes there are one-time IT investments that are needed as well, or extra contract dollars to make system adjustments that are beyond kind of the normal staffing levels. And so that's another big area that can manifest for costs.
Yep, it's a great call out. Okay, so if we go to the next slide, please. So this was the graphic. I'm a graphics guy, so I like seeing this kind of stuff. And as Dave said, it protects me because there are no sharp edges on this one. So I can review it fairly easily and happily. You can see the 4 major buckets drawn out here. And at the top, you'll notice this is about typically a 2 to 3 year process from beginning to implementation. So it's not something that happens overnight, and there are a variety of reasons for that. And we'll be going through at a high level some of those. But the 4 major buckets, the development, we actually craft the RFP, decide what it is, the strategy behind what we're going to try to accomplish, and then issue it from inception to, we have the idea to where we issue an RFP to get out to the market and see who's interested. When things come back, the proposals from interested bidders, that's where we go into that second bucket, the evaluation of those proposals that come back to try to figure out who would be the most viable and the most cost-effective and the best solutions that are available to us out of the market. Then we go to the negotiation process. This is where my background is heavy, right? This is what I've done most of my career. That's the part that I like. It's one of the shorter parts here, but it's the part that I get excited about whenever I see that on the chart. And then once the contract is negotiated and executed, we go to implementation. That's where the real planning happens, right? To make sure that we're not having unintended consequences, that things run as smoothly as possible. I once heard someone say that, if you shoot for a 1% error rate, put that into the context of your own industry, how many things go wrong and how many people are impacted by that. There's always going to be some level of error in any implementation. And so being able to plan for that and then mitigate for it is part of this process as well. So, yep. Question?
Is there a role for the board in any of this, or is this all staff driven?
So much of the work is done by the staff,
Mhm.
but the board, and you'll see this later in the
Sorry, got
presentation.
you.
No, it's okay. It's a good question. It's where we're bringing you information about how things are progressing, what we're seeing and planning, and we're looking for your feedback and input so that we can detail our strategic plan and perhaps refine it as we move towards implementation or contract negotiation. So yeah, there are definitely parts where the board is being aware. We want you to be aware and give us your feedback about your comfort level and if there are things that we're missing or not thinking about that you or the constituents that you represent would be interested in.
And then my other question, and this would be just you speculating, I suspect, since we don't have an active RFP process, is there consideration for current partners, their performance that is factored into the criteria for selecting it? Or is it sort of a blank, we're just starting with you responding to this RFP?
So I would say yes, right? Because the reality is we try very hard not to look at what's happened in the past with an existing relationship as we're thinking about moving forward. In the scoring of the assessing the proposals in particular, that's important. The reality is all of us that have lived through that relationship so far have that in the back of our minds as we're scoring. And so there's a constant kind of push and pull with the staff about how much of that should flavor and can it flavor our scoring. But you can never completely make a decision absent what you already know from the existing relationship. Dave, I see you want to jump in.
Yeah, I think I'll just add also at HCA, the breadth of our scoring team also helps kind of normalize and mitigate risks of that type of effect happening, because it really should be about the expectations for the future, the proof that is provided in response to the RFP as the ability to fulfill that expectation and going from there. And one of the things whenever we go through the evaluation training right before the true evaluation begins is reminding people the most important thing internally for a scorer is to be internally consistent. If you're a hard grader, be a hard grader. As long as you're consistent and we have a large number of people scoring, it kind of works itself out in the averages. The most important part is to be consistent in the criteria that kind of you're applying. So, I think the other part that I would add on is, especially when we get to the negotiation phase, that might, when you're negotiating the contract, that might have more natural influence on past experiences that you might have. But this entire process is typically it can be for a new product line like pet insurance, or it could be for like medical. And it's a reboot. It's also an opportunity to reboot the contracts and say we're changing the way that we are expecting X, or our service level agreements on Y, or the priorities are Z. So it is kind of that whole reboot process as well. The other piece I was going to ask, your first question, Allison, I already forgot it. I need to write notes.
The role of
the role of the board. One of the most important parts of the board's most direct role is when we get closer to that implementation period after the contracts are negotiated and we're moving into implementation, the board has to authorize the plan design. That you and Terry will remember that in particular. There was this process where we went through like, we need you to authorize a plan design so that we can then have a benchmark for financing, and then we can bring you rates later. And all of our contracts have, for PEB and SEB, have this subject to board approval. And so there is this ultimate veto power, if you will, from the board. We do this entire process and it culminates in these votes. But the reality is, like, you can say no to an entire carrier suite at the end of this process, and then that, we have an escape valve in the contract we just negotiated because the board, the plans are subject to the board's approval. And so there's a definite key role there. I think whenever we do a large procurement, we try to keep the board informed about kind of the major steps as they've gone along. We have to be really careful, especially after the RFP is issued and before the apparently successful bidders are announced, in particular about what we can kind of share, because we need to be, protect from potential protest issues that might manifest in that conversation. But we'll keep the board, whenever there is any type of procurement, appropriately involved. And then there is that ultimate plan approval necessity role that the board has.
I guess one of my observations was the reluctance of yes votes that we had, and that it would be too bad if that didn't affect what the procurement process looked like. So while I appreciate you can only respond to what's in here and not what feels like hearsay kind of thing, like how the rubric of evaluation is captured in that evidence for whether it's rate growth or redesign that doesn't impact these different pieces. I was curious about, how you have it be fair, because obviously if we have a lot of experience, we're going to know more about you than another carrier who can just give you a nice shiny picture of.
I think it's fair to say that the evaluation process and the scoring process, obviously the agency sort of builds that, but they're building it with the information they have for that day, the knowledge they have, the history of where we sort of were and where we are today and where we're going. And that all kind of gets embedded in that process. And it's, again, trying to take in the components of the new thing, how it impacts the members, the cost for the state, even their ability to implement in a time frame. If the entity says, "Well, I can't do it for 5 years," well, that's a problem. So it's all in the mix.
That's great.
And it's it's an extremely lengthy, complex process to get to the point where you know what you're going to score on, how the RFP is built, how are you going to score on it, and then what sort of pops out at the end, taking everything into consideration.
And I would just add to that, Lou, you hit the nail on the head. The way the RFP is crafted is where those artifacts from the prior learnings come from, whether they're positive or negative, right? Challenges that we might have run into are going to be reflected there and in the scoring, to Lou's point, as well as the things that worked really well. And we want to make sure that they continue to exist moving forward. So all of that kind of flows through not just the development and the RFP itself, but on into the contract negotiation and ultimately through implementation, because we're constantly looking back in the rearview mirror of what's happened. So David. Okay.
I was just going to give a specific example, but I think what you said, John, was perfect. So we had but I'll give a tangible example for folks. If we have a problem that we have experienced and we can create an expectation to avoid that problem, that's what you do in crafting the RFP. So an example we had years ago is like there's this 3 penny decimal problem. Like we can't go to 3/100ths of a penny at some point in rates in some of the systems. And so we were having all these challenges. So, the next time we went out for RFP, we're like, the third decimal place does not exist. How do your systems address the third decimal place? They cannot exist. And, we avoided that. It's a very specific, concrete example of like a challenge that we faced with one of our insurance lines at one point, and how rates were developed and the decimal placement and how far out you could go and rounding up and down issues. And so we learned that lesson and we addressed it in all future RFPs, the third penny problem kind of thing.
Yeah, and I've seen we've done all sorts of stuff like what the card looks like. The card looks a certain way. What information is going to go to the member? When is it going to go to the member? What is the metric that we're reviewing it so that we know it went to the member by the appropriate amount of time? So not only does the RFP get crafted to say these are all the things we want, then the scoring is based on the things that we want and the weight that's associated with it, up to the contract negotiations, which are now outlining the expectations of what you shall do, what we shall do, when you shall do it, all the way to performance guarantees and now we're going to be reviewing those metrics. And if you didn't do what you said you're going to do, there's going to be a penalty. So it all sort of flows, but the original starting point, which takes the longest, it feels like, is crafting the RFP.
Other questions? Okay, let's keep going through it. We jump into that first bucket, the development, move to the next slide. Thanks. So as Lou said, this is a longer one, year, up to a year and a half typically. And this is where, as I mentioned earlier, we want to establish the strategy behind what are we trying to achieve and how are we going to go about achieving it? What does the optimal arrangement look like? And then let's define that for the market so that they can respond and tell us what they can and can't do. Developing the RFP itself in a way that articulates that strategy to the market and allows them to respond, but also gives us definitive responses that we can compare, right? Compare and contrast so that we're not looking at apples to oranges with what they come back with. All that is going to go into the actual development of the RFP itself. We start crafting what the contract is going to look like based on that strategy of what we're trying to achieve. It will go through multiple iterations before the RFP even goes out the door, right? Because we're continuing to develop both simultaneously to support each other. As was mentioned earlier, the governor's office, the Office of Financial Management, others like all of you on the board, we're bringing you along for that journey so that we're giving you the awareness of what we're trying to build, and you have opportunities to provide feedback and input to that process. And then ultimately we finalize the RFP. And I forgot to mention down in the lower left, really important one, the Attorney General's office, as well as our own HCA leadership. All of those parties are involved and coming along on the ride with us, and having multiple chances to provide input. Once we finalize the RFP, we issue it in a system. We'll get into this in the next slide, WEBS, which is a contract and RFP system that the state uses. And we also publicize it so that our existing partners get the heads up that it's coming out pretty much simultaneously with when it goes to market and others can see it. We've talked about a lot of the other nuances of what goes on in this phase, but any questions on the development at this point? Okay, let's move on to the next, please. So we've got this wonderful RFP out there. Looks great. People are expressing some interest. What happens with it? We actually have formal project management structure that helps us, manage how we get the responses and what we do with those responses, how we manage them once they're back in house. But the RFP as it's coming back, I'm sorry, this is still in development. If we go to the next.
Just for the structure of this is we have the bubble slide that has kind of a couple of high level talking points, and then we deep dive into it, and then we go to the next section. So some of this you actually already said while you were on the bubble slide.
Thank you, Dave. So if we go to, there we go. RFP gets released. It goes on the Web Electronics Business Solutions so that it's available to the market. We give the simultaneous notices to our current vendors. And then communications produces a general press release letting the market and the wider public know that there's an RFP that's out there. This is one of the most common questions when we interact with the vendors that we don't have relationships with is how do I know when you actually do start a procurement that relates to me? And we have them register so that they get these notices from WEBs. The RFPs typically, once they're out to the market, have about an 8-week time to be live out there so that the vendors have a chance to prepare a response, a thoughtful response, hopefully, and give us the information we need to evaluate them relative to other bidders that come back. So move to the next slide, please. It comes back. We start the evaluation. And a couple of really important pieces on here as we're evaluating as Dave's the RFPs, as Dave mentioned earlier, it's a cross-functional team of subject matter experts, many of whom were involved in the development. Not necessarily all of them may have been involved in the development of the RFP, but they're clinicians, they're finance folks, they're administrative folks, and we're all looking at that, trying to figure out what's the level of lift if we went with this particular proposal to make it happen, and what would be the effectiveness of it. Of course, we're also looking at the costs and as well as clinical outcomes in the case of a health plan. We have a pre-proposal bidder conference. So this is a chance before they actually respond. Bidders can connect with us, ask questions about the RFP. And the responses to those questions are published so that all the bidders can see that. It's not just a one-off conversation with one potential bidder and us. As a result of that pre-conference bidding bidder discussion, they then have to give a formal letter of intent that's basically telling us we're going to bid. And then we have the Q&A period. Those again get published. And we evaluate and score the proposals that come back once we've had that interaction with the potential vendors. We select and announce apparent successful bidders. I want to be really clear. This is an important one. Just because someone gets chosen as an ASB doesn't mean that they get a contract, right? They get the right to move on to that contract negotiation with the state and with the agency, but it doesn't guarantee an outcome. All kinds of things can happen when we talk about that in a moment. And then this is also where there could be protests. If someone doesn't get chosen and they believe there's a reason that they weren't chosen that's inappropriate or unfair, they have the opportunity to protest that. We need to respond to that and before we can actually enter into any further discussions with the ASBs that were selected. So it's a very formal process. Any questions on that piece? 3 to 6 months from the point it comes back to when we're ready to move on. Okay, we advance the slide, please. As I said, it's, this is all the detail that we were just going through. I just, again, want to make sure that we draw the distinction. Just because folks were involved in the development of the RFP doesn't mean that they're necessarily one of the subject matter experts that scores what comes back in, but there's pretty good alignment and it's cross-functional. If we go to the next one, please. Next slide. This is a really crucial one, that first bullet point. When the RFPs first come back, and I'll give an example of this, we look to see if they're truly responsive to what we asked for in the RFP. An example of one from my past, we had a bidder that was chosen to submit a proposal. They did submit a proposal, and it was actually when we got into the evaluation phase that we were in a meeting with them, talking to them, letting them walk us through what they proposed. And they actually said, what we offer is a very focused, specific, esoteric call support service for members with a very specific disease state. What you were actually asking about was a generalized customer service call support system. Couldn't be more diametrically opposed. They're not at all the same thing. And the bidder actually said during the meeting, we can't help you with this. We'd love to still talk to you about what we can and can't do, but that probably doesn't belong as part of this RFP that you're currently looking at. And so let's not waste each other's times. It's looking for, are we in sync with what we asked for and what they responded with? Does it actually line up and should we move forward? There are multiple phases, both quantitative and qualitative aspects in scoring in both. And sometimes, as I just mentioned, we'll include a bidder oral presentation or bidder oral presentations so that they can walk us through where there might be differences and we can understand from our perspective what the pros and cons are for those differences or the specific proposal they gave us. And then all phases are scored regardless of whether they were quantitative or qualitative. They're scored separately and then amassed, and the ASB or ASBs are selected from that evaluation. Okay, next slide, please. So what does that all mean? What happens after we've had the evaluation? As I just mentioned, we could choose more than one ASB for some RFPs. It's not infrequent that that happens. And they're announced. The ASBs are announced via the web system. We hold debriefs if they're requested by any of the unsuccessful bidders where they want to know, why didn't you select us? Where did we fall short in the proposals or the scoring, things like that, just so they get a better understanding of what caused the shortfall for them. There's a protest period that's structured and formal. We observe that and following the debriefs. And then once any protests are resolved, we've worked through that, we've come to resolution, and or if there are no protests, we can enter the contract negotiations with the ASB or ASBs.
And just to clarify, the ASB announcement is a very public announcement. It's the results of the procurement. And John said it twice, I'll say it a third time. Becoming an ASB does not mean that you're guaranteed a contract. You can look at the history of this board. The original SEB procurement for medical plans, there were 7 ASBs that were announced. We have 4 carrier contracts that resulted out of those 7 negotiations that began as a result of the original procurement. The 3 iterations of Kaiser, Northwest, Washington, and Washington Options, and the Primera contract. Those are the 4 that resulted from that original procurement, though we had announced 7 ASBs at the time. So just a perfect example. Say another example is the original UMP Plus procurement. There were 3 ASBs announced and 2 contracts that were ultimately signed and then leveraged by this board for the launch of the SEB portfolio. So we cannot emphasize more that being an ASB is basically winning the right to negotiate, not the right to a contract.
Yep, it's not a guarantee to the point we've made several times, but just want to make sure we're calling that out. Thank you, Dave. And when we get to the next part about contract negotiations, some of you will perhaps relive some of those experiences, particularly with SEB, right? And going through those selections and the contract negotiations, and remember why there are multiple things that might cause a break in the negotiations and an ASB to not be potentially successful, and us as an agency not being able to be successful negotiating an ultimate contractual relationship. So we determine at the outset of this negotiation phase, which is roughly 5 to 6 months typically, which contract provisions are open to negotiation. And you'll see this in any negotiator's playbook, right? They're going to have sections of the contract that they will not touch, whether it's a regulatory challenge, whether it's, that's one of the most important things we need out of this arrangement. Could be for a variety of reasons, but there will be some things where it's just not going to be open for negotiation, and there will be others where there'll be some latitude, and that will be determined here before entering the negotiation phase or as we're entering it. We then move to negotiate the final agreements, and it's possible, and it has happened, that either the ASB could withdraw from the negotiation or HCA may determine that no agreement can be reached. And those can be for a myriad of reasons, right? They could be the administrative lift that's going to be required on an ongoing basis, a maintenance basis. Could be the admin lift to load and implement the project. Could be financial, something that comes out in the arrangements, something, and that could be abstract in the terms of a performance guarantee, right? It doesn't have to be the direct cost that's being negotiated. All kinds of things. They're very complex contracts. In the case of health plan contracts, they can be, over 100 pages long, and there's a lot of detail for folks to work through. We also, at this point, would begin data sharing agreements. Now, you could argue, why are you doing that if it's potentially not going to result in a contract, right? But we don't want to have that be an additional length of time after the contract is successfully negotiated, that we only then start with the negotiation of the data sharing agreements and the IT security review. That's making sure that any data that's passed back and forth between us and that vendor, or that vendor and their subcontracted partners, in the case of physicians and hospital systems with a health plan, that all of that is protected and is up to HIPAA and other standards, privacy standards. Ultimately, when all that is, sorry, go ahead, Dave.
No, I was just going to add that the data sharing and IT security reviews is also about viability of being able to have a contract. If an entity can't pass security review, or there is some insurmountable agreement or disagreement on data sharing provisions, that really does get to viability of whether a contract can exist at all. So we typically do not begin much implementation work until a contract is executed, but those 2 features are particularly lengthy in time and also have direct impact on viability of even having a contract. So that's why that gets subsumed within the concept of contract negotiations.
And in this case, anything like a health plan arrangement is highly regulated. And that's not just for the state of Washington, right? There are federal laws that are involved, federal regulations that, like with HIPAA, it's a major deal. And if we can't come to agreement about how we're going to comply with something like that, to Dave's point, it raises the question of, is this actually viable, and should we continue in the discussions? Or is there a way that we could resolve those concerns that's compliant? So ultimately, when all that's resolved, hopefully, we execute a contract and we move on to implementation. So questions about the negotiation phase? You can tell I'm passionate about that part. Okay, let's jump to the next one. So make sure I didn't leave anything out here. the one thing here is in the sub bullets on the second bullet point. If I've never in my career seen this happen where no one had any red lines of any kind, but if they didn't, we could conceivably say, this is a final contract, it's executable, and take that and the bidder's proposal. So if they issued no red lines, and as I mentioned today when we were talking about this, I can think of one example where there was one red line in a contract and it was something really superficial and it did not impact the working relationship or any privacy concerns. It was simply a business name had been entered incorrectly, and that was their red line, was to correct it. But that's extremely rare, and that was a very short contract. Wasn't for a health plan, by the way. Not the same level of detail that was required, but we can all dream. Once the complete proposal can be accepted, once we've resolved any of the red line issues and negotiated the actual permanent language that we're going to operate under, that will define that business relationship moving forward. And as is said at the bottom, my family would point out that it's many should be bolded, capitalized, and underlined, because I end up going home and talking about all of the various challenges and what are the ways to resolve them, or how crazy some of them can be on both sides, right? But it's very typical, as I've mentioned a couple times. There will be multiple red line changes, and we have to work through all those in this negotiation process. Okay, next slide, please. As I mentioned before, medical plan contracts can be hundreds of pages long, just given the myriad federal and state regulations, and others, accrediting bodies that might be involved in the payers business and or the providers that are in the provider network. And they'll continue until we come to agreement on the terms, the language. The bidder withdraws maybe is a way that the negotiations could end, as we said earlier. And we at our HCA, in its sole judgment, decides whether the agreement cannot be reached and on acceptable contract terms. So it's how it can conclude. If we jump to the next one, which I believe is about implementation, yeah. So this, again, is a somewhat longer process, 10 to 12 months. And there's a lot that has to go on here in terms of the data sharing, making sure that files transfer correctly, that they load correctly, things that manage, eligibility, premium charges, all that needs to be tested and made sure that it's running smoothly before we execute the implementation plan with the carriers and actually start moving towards open enrollment. So we want to try to minimize and mitigate any risks that are going to happen. And that will be a common theme. We'll come back to it in a moment about all of this, what it's designed to do. It's designed to do several things, but what I just said was an important one about mitigating risk for our members and business risk for the agency and the state, and our business partners. So we're preparing enrollment systems and billing systems. We'll finish the development and testing with carriers pre-open enrollment just to make sure that things are working. We hold the actual annual open enrollment and then transmit open enrollment files with the eligibility files to the payers for them to load and start managing and working with us on the claims and the billing files. And then ultimately, January 1st, magic day, new plan gets launched, right? And that's to keep benefits for open enrollment consistent, right? It's not, we just pick January 1st because it seems like it's a new start and it's a new year. That's typically when folks are expecting to make their benefit changes and selections for the coming year. And that's when they'll go live. So important piece, this will be on the quiz, plan goes live typically January 1st. And then we perform stabilization activities. I mentioned this a couple of times, but no implementation can ever be perfect. There will be challenges. And the point here is that this can go on beyond January 1st, where we see challenges that members are having or that our business partners or we might be having, and we're working to stabilize those moving forward. And that's an ongoing, you've heard it in some of the business 24/7 updates, right? Where we're identifying not just what needs to be worked on today, but what can be implemented for the future to make things better in the product, or the program. So a lot going on there, moving towards implementation and members actually being enrolled in the plan. And then if we go to the next slide, please. This is just calling out some more of the details. It's not just our systems, right? The carriers' systems have to be able to process this info. Has to align with the decisions that members are making during open enrollment. And there are myriad of additional enrollment and electronic systems that play into this. So we've got to make sure that all of it is connected and working as close to perfection as we can have for that January 1 go live date. And then we also have to obviously create member communication materials. We've talked about it in board meetings numerous times. How are members going to know about a change in a plan or that there's a new plan available or that the plan that they used to have is no longer available and what their options are, what happens if they do nothing? All of those kinds of things are into this creating the member communications to build awareness and support members' knowledge of the options they have in the program.
So the other thing that I'll add about this particular slide is the question will be like, well, is implementation shorter if you're implementing with an existing partner? And the answer is not necessarily. Part of like I said, part of a procurement is a reboot of expectations, a reboot of requirements, or on the HCA side, we might have a system change that's happening simultaneously or in close conjunction. So while if there's a new contract and a new implementation with an existing carrier, you know each other and you know some of the ways to work through things, but it doesn't necessarily mean that it is easy by any means or that it substantially reduces the amount of time for implementation. So I like to draw attention to that in particular because a lot of people will say, with the fungible timelines here, if you end up in any given procurement resulting with the same vendor or vendors for a particular insurance line, do you get to skip implementation? You never get to skip implementation because you're changing things, and that's part of the procurement process, regardless of what the ultimate results are of who you're partnering with on any given line. So I wanted to add that part.
Yep, good call out.
And when we reprocured, I was just thinking when we reprocured Regents, the contract changes significantly. That's our TPA for the Uniform Medical Plan. The contract changed significantly, and it was a huge implementation effort, even though we were with the same company. Yep.
And I can speak, having been on the region side at that point, there were significant changes in the contract arrangement that required significant testing and implementation on both sides to make sure that it was going to work moving forward. That's a great example. The one other thing that I would call out here, we talked about it earlier, but it's the board approval, right? We don't go to implementation until we bring it back to you. It's kind of like a performance review. Hopefully none of it is news, right? You've come along in the process with us. You've had chances to be aware and provide input. And it's now bringing that back, the formal, here's where we've ended. And you have the chance to approve that and adopt it before we get the contract signed and with the final implementation push is started. Okay, next slide, please. Open enrollment. The new portfolio plans, active enrollment could be anticipated, should be anticipated, encouraging choice and auto enrollment policies for those that didn't make selections where they needed to make a selection. That's the work that most of you have been involved in already on the board, and we as the agency are helping drive that. And you can see the number of subscribers and dependents we're talking about here. This is a big deal, right? Making sure that this works right for roughly potentially 800,000 people. It matters. This is work that matters, but it's also a multifaceted with multiple scenarios. If we've seen one person's enrollment, we've seen one person's enrollment, right? Or one family's enrollment, whatever the case may be. So it's extensive communications have to go out about that new portfolio and making sure that folks are aware and that they understand. You as board members have raised this in the last couple of board meetings in particular, that they understand what these options represent to them and what changes they might be inadvertently or hopefully consciously signing up for, just to make sure it's clear to them. And the benefits administrators, of course.
So the other thing with open enrollment to remind folks about is I'm going to draw an analogy back to what I was saying a little earlier this morning about UMP Plus closing. And when we have new employees who come on right this fall, they'll be able to pick UMP plus, but then the world is different for them when the fall open enrollment hits and they're picking plans for 2026. And the purpose of this presentation is to be responsive to your questions about, is it time for a market check, or what would it take to do a market check on the medical side of the portfolio for the SEB program. So let's just play this out going forward. Like if there were a procurement and new plans authorized, we would end up in a similar scenario in that implementation year where there are new school employees that fall who are picking from the old portfolio and then at open enrollment needing to pick from the new portfolio. So just like there is that transition whenever you are rebooting a portfolio, whether it's dental, whether it's life insurance, whatever the insurance line is, or if it's a new product, let's say it's pet insurance, like there's nothing to do when you're a new employee until the benefit launches. But there is that transition period that exists and would be, I know would be a communication challenge for folks is, today in September, you're a new school hire and you need to pick from this slate of benefits at a glance that's 6 to 8 pages. And in 60 days, you're going to pick from a new slate of benefits enhanced at a glance. And there would inherently be a communication challenge there. But I did want to draw attention to like that aspect because it is a unique part of open enrollment whenever you're transitioning or rebooting an insurance line within a portfolio. Pam, you have a question.
So with this whole process, though, we've had begrudgingly yes votes, reluctantly yes, all of this. Does it take a directive from us as the board to initiate the process of looking at other carriers, looking at other plans, or is it staff just listens to all of our discussion and goes, the board was saying this, that, and everything else. Let's start at least the research. I mean, do I have to say I move, that kind of thing? Or is it, this is fluid and we're going to listen to everybody?
I'd say it's more the fluid process. There does not need to be a directive from the board.
That's what I want.
Some sort of steps can be taken that, without the board passing a resolution or a motion. John referred to this at the beginning that there's part like the decision package process. Like if, that's where there was the question earlier, like, where does the legislature chime in on this? To some extent, if we identify whenever an agency, and I'm saying agency generically, not just the healthcare authority, needs to do a procurement and they need additional resources, that's kind of a temperature check on all the other parts of the authorizing environment saying, yep, this is the right time to do it. We're going to dedicate some resources to this. The blessing of a decision package is also kind of the blessing of proceeding, those kinds of things. That's usually, that's a bit more needed, but we don't need some sort of direct action from the board. Allison and Terry might go, but wait, 8 years ago, I think we did have an action in the context of like creating the entire program. We thought it was important for the launching of the program and there was a lot of public scrutiny. People might remember the TVW was literally here with cameras. I think they're still streaming these days, but there was a lot of intense interest, and we thought it would be really helpful for everyone to see all aspects of the process and to make sure that, but it's not actually a necessary step to proceed.
Thank you. But I could hint loudly, couldn't I?
I hear you hinting loudly.
I'm picking up what you're putting down.
Yes.
Yeah. Okay, if we move on to the next slide, please. So the post-open enrollment stabilization, as I said, important. Plans typically go live on January 1st. The OE stabilization work may be required. It's usually some level of stabilization required after go live. And that work typically can run through the first quarter of the first plan year. So no surprises there. I think we've all lived through that. And the implementation usually continues past the launch date as a result for new plans, where we're making sure things are running as smoothly as possible for our members. And next slide, please. So back to our lovely graphic representation of the 2 to 3 year process, the 4 major buckets. I will also point out that in the appendix, we've included a slide that gives much more of the details in each of these buckets from the slides themselves, but it's a fairly busy but graphic representation of each of the stages of the process and what all is being done that might be helpful to take a look at. But Has there ever been an implementation shorter than 2 years? Probably. Has there ever been one that lasted longer than 3 years, an RFP? Probably, almost assuredly. But typically, this is what we would expect to see. So any questions at this point about the overall process, the timing, additional things you want us thinking about or that we can help you understand at this point?
And I'd add, I think this is a great time. Like, if there are things that you're like, oh, here are things that we would hope, as you're tapping your foot, Pam, if there's specific things that you want the agency to hear of, like, oh, if there were a procurement, here are things that we hope would be focused on. It would be a great time right now in this meeting to share that, since board season ends today. So just wanted, put a fine mark on that as well, and definitely monitoring the board members who are virtual as well. So, okay.
Trying to think how to politely say this. I would hope that all right, I've been doing this a while. I'm been teaching a while. And I remember the WA plans of old. And with my recollection, there were more options. What it feels like right now, it's Kaiser, Primera, UMP, and that's it. I don't know feasibility, but it would be great if we could look at having more choices. I remember Primera used to have 5 options. Now there are 3. I mean, I know, and we could get into the weeds of it, but to me, it always felt like there were more options to pick from. I don't know if that's feasible, but it's kind of like you're stuck into.
Can you clarify for me, when you say more are you thinking more networks, more carriers, or more individual product lines within? Both. Okay. I wasn't sure if it was a both and.
That's my memory. That was my memory. Way back when I can remember there were 5 Primera options within the WA plan. And there were lots of different carriers, and then there are lots of different options within. And I know when you start, it's going to be an expense. I know that. But I think that would be at least something to pursue to see, is it feasible? And now my foot's going to stop shaking.
Thank you for clarifying.
Absolutely.
And again, any questions about the entire process? John's going to have some more slides to talk about mitigation, but process or things that, if you have interest in related to any theoretical procurement. Donna, your hand's up.
Oh, just to piggyback on what she said, I do believe, though, the WA had a condition that they only gave you the lower rates if you only offered one other out-of-network option. So yes, it was like lots of options within the WEA, and then they could have one other carrier in order to get the rates that you wanted for WEA. Is that correct? I would like to see more options of more networks, though. I agree with her.
I appreciate, Donna, you also describing just some of the yin and yang relationship that happens in negotiations and conditions that exist that plays into the point of more options, more breadth. That might be in tension with that at times. So, anybody else remote? Just checking. John, why don't you talk about mitigating?
Yep. So this whole process, I said, kind of alluded to this at the beginning, but we'll bring it home now. Go to the next slide, please. The best practices in the RFP, some of this is structured and regulatory in nature. Some of it is designed to do numerous things, but a major component of this is to ensure we take a measured approach and a defined set of rigor around mitigating risk for implementation. We want to make sure that we have fair and accurate procurement process. We want to make sure that there's, the file testing and that the user interface has been tested to ensure that members have as smooth of a enrollment process as possible. The billing and premium accuracy, we talked about that earlier. The member communications and public communications, we've talked about that. And then the carrier performance metrics, which typically are going to be manifested, whether they're in performance guarantees or contractual requirements in the contract documents that define the relationship. all of that is there to try to mitigate risk. But again, it causes some of the complexity in this process and explains in some parts the 2 to 3 year timeline to get here. So could we do it faster? Again, yeah. But if the faster we go, typically, for a variety of reasons, the more risk we see with the implementation. So I want you to go ahead, Lou.
Yeah, I was just going to say, this is something we're good at. The agency is good at this. Lots of people are involved. There's the main project team, then there's subgroups, and there's work streams all over the place between the finance, communications, even hiring the positions, bringing people in to work on this, our actuaries. It is a massive endeavor, but this is what we do. And so I have full faith in our ability to get through this and to figure out, what do we want and how are we going to ask for it and how are we going to evaluate it? And then at the end, how are we going to implement it? So.
And I'll offer just the slight tempered expectation. Well, we are very good at it, but we aren't infallible. Protest periods exist for a reason. I can think of one contract, one procurement in particular in my mind that comes. I was like, there was a protest that was raised by a vendor, and we looked at it and we're like, canceled procurement and started over. It's like, point taken. Like, and we learned a lesson on that. So, just like anyone, we're not infallible, but we are good at this work. But the procurement process exists to make sure it is fair and equitable. And from time to time, something happens and we learn a lesson, and that is part of the business as well.
Is the same team that evaluates the PEB and SEB plans the same that would evaluate the Medicaid? If they re-procured as well, or is...
There's not substantial overlap between the teams. Some of that relates to the funding. Like, I'll just use Tanya as an example. Like the finance team for Tanya and her team, they're PEB/SEB dedicated funding, and so the financial team is predominantly going to be folks who are in the PEB and SEB programs. But we often will cross-pollinate across Medicaid and PEB and SEB to give additional perspective as well. So while it's not completely separate, it's not also a complete overlap. It's a Venn diagram where there are some commonalities between it, but not substantial overlap.
And that is a really good example because, as you move up in the agency, then all of a sudden you start having more breadth of responsibilities. So at the end of the day, Megan would weigh in, and Megan is over the whole show. So yeah, it's definitely, there'll be some dedicated people who work on PEB and SEB. Then there'll be some people who work on both programs. There'll be some people who work just on the other program, but are brought in for their very specific SME information that they have. So we try and make sure that the project teams are complete and we have the resources at HCA. And if we don't have them, sometimes we contract those resources out. If we need something and we don't have it, we go get it.
I think the other thing, talking about resources, and Myra, just want to confirm, do see your hand to chime in, is the way that we historically craft procurements is there's large different topical sections. There's a clinical section, there's a finance section, there's an operations section. And so some people score the entire thing and some people score where their much more subject matter expertise is. So we do, it truly is a village effort. And we think very carefully about how to appropriately resource and not over-resource and overburden people. But the other thing is these evaluations can take a substantial amount of time. John had highlighted 3 to 6 months. Some of that depends on how many responses are received. Lou will remember this example. When we had a particular procurement, we had 3 bidders, but the responses came in on pallets. Literally, the response,
slightly soul crushing.
Yes.
The warehouse called and said, "What do you want us to do with these?" And I go, "What are you talking about?" They're like, they say procurement response or something on it, and we're like, "Oh no." Yeah.
Because we had 12 paper copies needed, and they were I think it was like 10 inches of responsiveness in paper, because you get down to like a college essay, 10 pages front and back, single spaced, margins no bigger than this, but that adds up real quick. So it can be a really substantial amount of time, and that amount of time for evaluating really can vary based on just how many responses there are to get through. So Myra, you had a point or a question?
Yeah, well, actually, you just talked on one of them, because sometimes I know with RFPs, you get them in and none of them are like acceptable, or you're like, no, and it's like back to the drawing board. or you reopen it. And so that could extend the timeline past the 3 years, I believe. And then my other question or comment was, so in the meantime, knowing 2 years is probably the soonest because of risk factors, and I understand that and appreciate that. And there's a lot of work that goes into it and a lot of factors. Do we just maintain what our current options are? What is the risk of actually eliminating someone? Because I'm concerned about, Allison brought up earlier, we've got patients, not pay, well, yeah, and they're used to what they're used to. And so to say, well, we got something coming down the line that might really be great. In the meantime, we're gonna, not have this one anymore because I know we're not happy with a particular carrier right now. So 2 years, and we've only got, we do 1 year at a time. So what are some other things to look at or thoughts? I don't know. I'm just kind of throwing ideas out there and something to think about. What do we do in the meantime? And what if it goes 3 years or longer if we can't get requests that we really like or want to hear?
Myra, some of it is ongoing discussions with the carriers. Some of it is the procurement process every single year. It is a brand new process that starts over. And so a lot can happen in a year and a lot can happen in the sort of off season. Things can happen during the legislative cycle as well. So there is a ton of variability there, but it's safe to say that when this meeting ends today, we don't just fold up the tent and then come back in January and be like, okay, what are we doing now? What are we working on? So there is a lot of stuff that's going to happen in there. And I think this board season and the comments from the board and now this presentation, I think is going to spur some discussions. And yeah, it's a very dynamic environment. Let's put it that way. And we always are trying to make sure that our members are getting a cost-effective, high-quality product, always. And there's 100 different ways that happens every single day.
We will fold up the tent until Monday. We'll give everybody the weekend, a solid weekend to decompress and then get started. We won't pack it up till
Is
January.
that true, Alyssa? Are we just going to be
Well,
taking a
except for
break?
Alyssa.
Yeah,
Open
except for
enrollment.
Alyssa. Yes,
I
she's
meant
gotta
more
go.
for Tanya and Shauna. But your question also illustrates a really important point, Myra, that anytime there is a procurement that talks about like rebooting a part of the portfolio, we also have to keep running the current portfolio. And that, let's say there is an RFP that's in the work that ends up happening for the medical part of the portfolio. We still have an annual renewal process with the existing slate of plans and rates that has to be continued to be developed to dovetail with whatever the results are of that procurement. So it is a lot of juggling of talking about, we often say, I have no idea what year it is until I look at a calendar, because it's really hard to keep things straight in that standpoint. But that would also happen with the board because we'd be talking with you, as we said, in implementation. There's a part where the board would have to authorize plans for that future January year and that open enrollment shift from slate A to slate B of offerings. But we'd also be talking with you about slate A's rates for the the remaining time that slate A is available to folks. So there's a lot of simultaneous work that would have to be staged to make sure that everything keeps going in the current state while there's also a planned and appropriate and mitigated cutover to a new state. But I think the important part is that annual renewal process doesn't stop just because a procurement, occurs for a future year.
Thank you.
Checking any other hands virtually. Okay. John, maybe, or John, Lou?
Yep, I was just going to say, I appreciate everybody's time today. There's a lot here, right? So as you're going through it, thinking about it, if you have other things you want to make sure that the teams here are aware of, or you have other questions, don't hesitate to reach out to me directly. I'm happy to try to get you answers or share insights with you. And I will try, Pam, before the next meeting to get a pair of shoes that you will call out. I was kind of disappointed that my shoes didn't get noticed. So next time I'll have something a little flashier on, a little more stylish and on trend.
That's going to be our thing now, isn't it? We're
Yep.
going to be calling out shoes.
I do want to highlight the appendix. I think John said it this way, but just so you don't like flip back and forth too much, that final slide, each of those columns is really the embodiment of all of the short bullet points that were on each of the bubble slides as he was going through his presentation when he was doing the 25,000 foot. So if you're flipping back and forth, they should be identical. This was just synthesizing it into one spot, so you didn't have to look at 4 slides if you didn't want to. So just confirming that so that you're not flipping back and forth going, is there a difference? No, this isn't a highlights, find, spot the difference kind of scenario. And I will continue to wear boring shoes so that nobody notices me.
I only have one pair of work shoes. That's it. All right. Any final questions or comments for John? All right, John, thank you so much. Appreciate it. All right, our 2026 board meeting schedule. Dave, we finalized?
Well, there's nothing different than last week. Just wanted to give people space. We always try to put it out there. If anybody has any feedback, I think I heard generally positive feedback about staying on Thursdays from your guys' standpoint, so that, you know, except for the rare occasion we stay on Thursday scenario. A lot of positive feedback to me about avoiding the week of Juneteenth, just a hectic time in people's lives. So I hear, as someone who doesn't have kids, I hear it's really hectic that right around that time as school's changing and camps are being figured out and who's doing what, and just trying to give a little bit of relief there. So, you know, please start marking your calendars now. After this meeting, Jessica will go file it in the code revisor's office, and we will be off to the races. So this is the schedule for next year.
Any questions or comments from the board? All right. We are at public comment. So if you would like to speak, raise your virtual hand and we will collect your names. And again, we'll be activating your ability to turn on your audio and video once we call your name. Going once. Going twice. All right, no public comment for today. This is our last board meeting of the season. Our next meeting will be board retreat, January 22nd, 2026, starting at 9 a.m. with the same format, being able to be in person or via Zoom. Any final comments, Dave?
It's really hard to predict anything a week out, but 6 months from now, we'll at least be talking about how open enrollment went. There'll be a governor's proposed supplemental budget that's out, and the legislature will be in town for 2 to 3 weeks. So Cade will be back with what's happening with bills. And then as I preview, you know, we're going to continue understanding the federal legislation that passed this month, any other activity that happens from the federal government, whether it's bills, budget appropriations, rulemaking, guidance. There'll be all sorts of things. And so I anticipate that we'll be able to do kind of an update on things that we've learned over the next 6 months when we're back together in January. So those are a couple of things that I know that we'll cover come January. So yes, 2026, folks.
You know, I just wanted to comment too. I really appreciate the board's engagement and people being candid and feeling comfortable. You know, there were times when I was running PEB where it felt very stiff. It felt very intimidating. The room was full. We've got all the mics where it's being recorded, you know, all the stuff. I remember when TVW came in, that kind of froze everybody up a little. It's like, we're on TV. So I'm glad that people feel comfortable. I'm glad that people are expressing their opinions, because the agency really does take the board's opinions to heart and to understand what is the direction the board wants to go, and tries to figure out within the construct of our authorizing environment and our agency, you know, what is the art of possible. So just wanted to thank you all again for your really active engagement and your thorough feedback. It helps. And the agency, obviously, Dave, your staff, putting everything together and doing, there is a monster process behind the scenes which prepares each board meeting. And having SEB and PEB going at the same time, it's a rodeo. So, but it looks good on this end when it comes out. So I think that's a testament to all the work. That's about all I have for today. Thank you all. It was a great season, and we will see you January 22nd, 2026 at 9 a.m. Same place. Take care. Meeting's closed.